Hello, my name is Alex Christ. I'm a family physician and I teach and practice at the Fairfax Family Practice Residency. I've been here since 1999 when I finished and I graduated as a resident. I want to start by thanking you for participating in our study. We're one of 6 states across the country that's doing this unhealthy alcohol use study. We're trying to help 125 practices do a better job about screening their patients for unhealthy alcohol use and counseling their patients about changing their behaviors. This is a really important study, and the National Secretary for Health has taken this up and they've been promoting it, and the governor here in Virginia is also supporting this study. For today, we're going to talk about a couple of things. We're going to talk about what is unhealthy alcohol use, why is this important, how do we screen patients for unhealthy alcohol use, what do you do with a positive screen, and how might you think about some practice workflows for dealing with this. So let's start with why this is important. So right now, unhealthy alcohol use is the 3rd most common cause of preventable deaths. There's about 88,000 deaths per year due to unhealthy alcohol use. This is from cancers, chronic disease control, trauma like car accidents, and even alcohol overdose. About 26% of adults binge drink, 6% of adults drink heavily, and yet patients say that only about 13% of the time that their doctor even asks them about their drinking habits. And those patients that have risky drinking, only 7% say that their doctor counseled them about changing their drinking habits. What's worse is that with COVID and the pandemic, all of this is getting worse. Alcohol sales have increased by 30% since the pandemic started, so we know that these problems are even worse now. So the U.S. Preventive Services Task Force gave a B recommendation for clinicians to screen all adults age 18 and older for unhealthy alcohol use and provide counseling for those who screen positive. So I'm on the U.S. Preventive Services Task Force. It's one of the reasons that I'm interested in this study. And I'll admit that I did this all wrong until we studied and made this recommendation and I looked at the evidence. I was taught in medical school that the questions you asked were the cage questions. Do you need to cut back? Do people feel angry about your drinking? Do you feel guilty? Do you need an eye opener? Those are good hospital questions. They're good for finding patients who might be at risk for withdrawal in the hospital. But this is not the question to ask for unhealthy alcohol use. And I was never taught how to counsel patients about unhealthy alcohol use. And the good news here is that when you find patients with risky drinking, clinician counseling can be as effective as your counseling for getting them to quit smoking. It can take 90 seconds or even 30 minutes over a number of visits, and it works to change patients' health behaviors and improve their health. We'll talk more about counseling at the subsequent lectures. But today, talking about screening, let's begin with the definitions. So risky drinking is men aged 21 to 65 who have more than 4 drinks per day or more than 14 drinks per week. And it's women and men over 65 who have more than 3 drinks per day and more than 7 drinks per week. And then adolescents, pregnant persons, all adults who do things like drink and drive or operate heavy machinery. Binge drinking is defined as anything that gets your blood alcohol content above 0.08. So roughly this is 5 drinks for a man in 2 hours and 4 drinks for a woman in 2 hours. Now, if you move across the spectrum, we think of abuse. Abuse means that alcohol is starting to cause trouble at home, work, or at school. And then we think of physically hazardous drinking. So this is drinking and driving, something that could jeopardize your life. And then we think about having legal and social problems. All those things define abuse. And then dependence is when you have physical cravings, frequent consumption, withdrawal, and tolerance. And that's further along the spectrum. You can see here on this slide, this is the 11 different diagnostic criteria for the DSM-5 to define alcohol use disorder. This will be on the website that we've created for you. You can go back and look at this and print this out. If you're seeing a patient and they screen positive, you want to explore if they have these different 11 elements that would define alcohol use disorder. There's 2 good screening instruments that the U.S. Preventive Services Task Force recommends. The first is the Audit-C. It's 3 simple questions. How often do you have a drink containing alcohol? How many standard drinks containing alcohol do you drink in a typical day? And how often do you have 6 or more drinks on an occasion? You can see underneath each of these questions that there are 5 different answer responses. And you can just ask them, how often do you drink? And then you can fill in to the bubble as to where they are for their drinking. But the first response gets a score of 0. The last response gets a score of 4. And a positive score is 4 or more for men and 3 or more for women. Now the SASQ instrument is just one question. You're just asking about binge drinking. So for men, how many times in the past year have you had 5 or more drinks? And for women, how many times in the past year have you had 4 or more drinks? A positive score is more than 0. So if they say 1, 2, or more, that's a positive score. This next slide shows you the distribution of the Audit-C scores. This distribution is really useful, and this graphic is on the Unhealthy Alcohol Use website that we've created for you. When you're counseling patients, you might want to give them this graph, and you might want to show them where they are on this score. This was a study done in the Veterans Administration. The first slide shows you men, and the second slide shows you women. So you can see where your patient scores, and showing them, particularly if they're in the red or the orange or the yellow level, often motivates patients to change their behaviors, to normalize it, and be more like other patients. So how good are these screening tests? So their sensitivity, meaning their ability to detect someone who has unhealthy alcohol use disorders, pretty good. It's about 65 to 97%, depending on the study and the population. The specificity, meaning that they truly have unhealthy alcohol use disorder and that you don't have, for example, a false positive screen, it's also about 60 to 90%. The single question, the SASQ, is a little less specific, so if it's positive, you really need to follow that up more. And the Audit-C, if it's positive, similarly, you probably want to follow that up more with a greater history. So what do you do with a positive score? You can ask the full audit, so there's a series of questions for that. You can explore the DSM-5 criteria. You can ask patients more about their drinking patterns, if they're ready to make changes and want to make changes. And then depending on whether they're ready and want to make changes, you could start counseling. And then you want to think about, how do you want to document this in your electronic medical record? So we're going to have a series of meetings with you in your practice to talk about this, so that you can think about the best way to document this, so that you and other providers know that someone's had a screen and whether it's positive or negative. And then you probably want to schedule a follow-up for patients that have a positive screen. Maybe in 2 weeks to talk about a plan and see what they're doing. Maybe later or sooner, depending on the severity of their illness. So here's another slide that just gives you an overview, and we're going to talk about this more in the upcoming lectures in your practice meetings. But what you see at the top line is when you start with routinely screening a patient, and you're going to find patients who have risky drinking. So if they're just on the risky drinking scale, that's a good point to do brief primary care counseling. Normalize their behavior, tell them what their goals are, see if they want to make some changes. And then you probably want to follow up with them. The folks who respond, reinforce their behaviors, get them to keep doing it and not slip back. And those that don't respond, particularly if they're having problems in their life, maybe that's where you elevate treatment and think about medication assistance therapy or refer them to counseling. You're also going to find patients who are more severe on the alcohol use disorder spectrum and have moderate to severe alcohol use disorder. Those patients you also probably want to provide brief counseling, but you'll probably also want to begin with considering medication assistance therapy or begin with referring them to therapy. Therapy can be one-on-one with a counselor, doing cognitive behavioral therapy for someone who's tailoring that to reducing alcohol, or it could be a more formal alcohol reduction program that's group or individual as well. So we've created a website for you. We've got a number of handouts that you can use when you're seeing patients and that you can give to patients. All of this is available, and we'll keep talking with you in your practice about good ways to screen, counsel, and help your patients. Thanks once again for participating in this study with us.